Good morning, Dr. Bora. How are you?
I'm fine, thank you so much. How are you?
Welcome to the All Pulp No Fiction, the dental podcast.
That's cool.
Congratulations on your book.
Thank you so
I
much.
saw everyone, taking pictures with you. And
It's very kind of you. Thank you so much.
okay, so first of all, like how do you feel about this IDS? Is this your first time in here?
No, I've been here many times. The second time with the GC booth.
see.
I'm here also for the second time. But I can clearly say that it's getting bigger, larger.
Yeah, right.
every time. But every time it's making me surprised because really I'm coming here with a big energy all the time at the very first day. But then I'm walking to see some friends, to see some companies, to do some workshops or lectures. But always at the end of the first day, at the very first day, I'm done. So very exhausted.
Tired.
Which is good, by the way. Which is
I
good.
mean, this is good exhausted, right?
Exactly.
The vibe is good at least.
Exactly, exactly.
Yeah. So
Beautiful place. Thank you. Thank you for inviting.
No worries. No worries. It's a pleasure to have you.
Thank you so
honest.
much.
So first I want to ask you something before we get into the lectures and stuff.
Sure.
The picture you use in your book, you publish a lot of papers and, you wrote this, you published also this last book. And papers are good and pictures in it are good, but there's something special about, a book with beautiful pictures
The
on it.
photography, you mean? I
The
get
photography is very nice. So
Yeah.
how do you get these results? How did you learn
Go.
the photography art? And if anything you can share.
Yeah, it's a long story actually because the book story is another one, but everything starts with photography. Really, everything. Trust me. The social media, the relation with the companies, research, reputation, money in other time. Yeah, honestly, everything comes with the photography to me because you can do many good things, but if you cannot record them and show them to the people that you are doing something good, it's nothing so important. So this is the point in my opinion. And nowadays we are also taking videos, So for the book, it was like maybe 10 years or older than that story because I've been recording the cases. As soon as I finished dental school, I got a photography. It was a simple one. But I started doing it, and in time you will see that you are getting better in this, and you are seeing your failures, and this is the way to improve yourself actually.
Right.
And photography helps this a lot actually at the same time.
Exactly. Yeah, you start to see all the little things that you maybe did not see when you're just looking at the
Exactly. And it helped to my book also. I also use the very old photography images that I recorded and also the new ones because all of them tell something. All of them shows the root of you getting improved in years. But everything started with it. A very good question to start with because everything started with photography actually.
Well, thank you very much. Also, just a quick question: why did you choose that picture for the cover?
Good. Okay. Because it's
You
about
said like 10 years, right?
tomorrow's
So
lecture because is the morphology, and it's showing the external surface morphology of a restoration that I really liked after I did it. Maybe for the patients, honestly, maybe these are not very important topics because they are only most of the time taking care of the shape and the shade matching.
Yeah.
But for us, for dentists who are getting improved in years and asking for more, we are also asking for some internal and external morphology. And in that book, I wanted to show the people that they will find more than the simple things. Actually, there are many advanced things also inside, but also very simple things for the simple ways and simple solutions for the restorations. This picture tells a lot in my opinion, but I'm not sure everybody is getting it, but I hope they get
And
it.
honestly, when I saw it, it was like very interesting.
Thank
and
you
then,
so much.
Yeah, I just wanted to ask you, like, why did you choose this one?
Yeah.
Anyway,
you.
so let's go back into a little bit of clinical tips and knowledge.
Sure.
Aesthetic restorations are beautiful, but if they don't function well, if they're not,
Very good topic.
there's no longevity to the restoration, like it's basically
Totally agree.
Right?
Totally agree.
So, first of all, like, how do you start with material selection? How do you make sure that this restoration is going to last for long?
Yeah. As a dentist, our work is to provide some good-looking, highly aesthetic restorations, but it should be functional in long term, as you said. So this is very important. And in the research, if you look at the literature, you will see that this is the first reason for failure, actually, the fracture of restoration, or wear, or chipping. Yeah. So we have to select the material properly. This is a very good point. And then we have to apply a very good clinical application technique to make it long lasting. So this is very important, and everything starts with the material selection, and then it continues with the technique we apply. So there are some materials which are very highly resistant to the fractures, or nowadays due to the filler ratio and the contents inside actually, and the resistance to the discoloration and many other things. But there are many still in the market that are weaker. So we have to select it properly, and then we will talk tomorrow about the techniques about it during the workshop also, everything. But everything really starts with the occlusion, so that we have to check if there's a parafunction or something else, so that we have to get rid of this if possible first, and we have to make the patient ready for the composite or minimally invasive, let's say, restoration. So that I start using a lot of aligners pre-restoratively nowadays. I'm also lecturing about it. So if you align the teeth or change the vertical dimension with the proper restorations, I'm trying to say that if you adjust the occlusion, but not the static, but also the dynamic occlusion properly before the restoration, then your restoration will be long lasting. So this is also very important.
This is very important.
Yeah.
Okay. And as for the materials that hit a good balance between strength, like physical properties, and aesthetic properties.
Yeah.
Which materials do you prefer to work with?
We have very good ones now. I cannot say that we still have the perfect material, but we have some very close to the target, I can say. I always say like this. So we have to wisely select the material. Otherwise, we will maybe still have a very good aesthetic and functional result, but it will take a lot of time and a lot of effort. So nowadays, the materials are very improved, the composites, I mean, and they can also tolerate our mistakes during the shade matching, during the technique problems maybe. And these materials are very good and let's say, smart materials, let's say. So, for example, if you're using some material like GC Accord, Genil Accord, then you have a big advantage that this material can tolerate many differences, like the shade matching problems or technique problems or polishing problems. It's another topic. But you can achieve very good results in a very short period of time with less technique sensitiveness, let's say, with those kind of smart materials. So the material should be selected wisely.
When you work, for example, for an aesthetic restoration, do you use one lineup of products, or like, for example, do you use only Genil Accord, or do you, for example, use it for certain layers and then use some other composites,
Mixing it with another one.
Mixing and
I got it. It's a big advantage in my opinion. With those kind of, as I mentioned, the smart products, you can, in my opinion, achieve most of the posterior direct restorations, but many of the anterior direct restorations. But still there are some gap, as I said, there are no perfect material. So if you have some experience in your pocket with some of the other ones, like maybe one more chromatic, one more durability, higher durability with one, or something like that. So you have some playground, okay? So you can play with them, you can mix them, you can. Sometimes it's needed, really. Sometimes we need to make a restoration more chromatic, so that you have, in your experience, you will say that, okay, this one has more chroma, so I have to use this beneath as a dentin layer, for example. So this is a good option. If you have that experience, you are stronger in the field. But if you are using only one, with a smart selection, you can still do many things, but not all the things, I can say that.
Okay, so sometimes, you start the restoration, you like you said, you make sure that the occlusion is going very well.
Yeah.
You choose the material very well.
Yeah.
But I think final touches are also very important.
Yes, exactly.
Like polishing, texturing and polishing are also quite important. And what procedures or what tips do you have to make sure that, you finish it well? So you make sure that the restoration ends up looking well at the end.
Again, it's the same. We are in the IDS. Every year we are seeing new improvements about the polishing ability of the material and also the polishing materials.
Yeah.
So these combinations should be very well in order to achieve a very good high-end and high color stability and high-end aesthetics, actually. Mm-hmm. So nowadays it's simpler, again, with the wise selection of the composite and wise selection of the material. I'm always saying the same, but it's just like this, actually, really. I can make sure that you can achieve very good and the similar maybe results even with the older techniques, but it will take a lot of time. You will have a lot of risk when you're doing this. But with the new materials, it's impossible. But nowadays, if you want to create a very good high-end aesthetic results with the external morphology. You have to provide primary morphology for sure, secondary morphology for sure, in my opinion, maybe tertiary morphology, which is not very important for the patient, but also in a Saturday's lecture we will talk about it, how to quickly and very effectively we can create all those morphologies with very simple materials actually in a very short period of time.
I see. In the end, if there is one takeaway point from this podcast that you would like to share with our listeners or viewers,
Yeah.
what would you tell them to do?
I told about a lot, but I will tell the same thing again. The dentistry is improving a lot. So with the wide selection of the materials and wide selection of the techniques, everything will be easier and more effective in my opinion. So the thing is, we shouldn't focus only on the aesthetics. We have to focus also on the functionality. This is very important, as you mentioned. And also, we have to know what material are we using, and we have to know the indication range of it. So every case is not indicated for every kind of restoration. For as an example, we are talking about composites. So that time we have to make the case indicated for it with the pre-restorative approaches. So if you look at the case as a whole like this, if we make the treatment plan accordingly, including the material selection, including the technique selection, and including the pre-restorative approaches, it will be a very successful restoration in the end, in my opinion.
Yes, sir. Thank you very much.
Thank you so much.
Appreciate it.
It's a pleasure to meet you. Thank you.
Nice.